All right, everybody, this is Dr. Jenkins. This is going to be our start to the respiratory system. In this first video, what I want to do is I just want to lay out the basics. Anatomy, some basic structure stuff, so that way when we're back in person, we can get into the real fun physiology. Okay, so real quick here, let's just get a start. I'm going to skip the fact or fiction. All right, here we go. Let's just make sure we talk about the respiratory. We probably already know what it is composed of. It is composed of the respiratory tract. And of course, the respiratory tract has an upper and a lower part. And it's also going to include some muscles, which I think once we bring it up here, it makes sense. What are the muscles that are going to expand our thorax and ribs and then help them contract a little when we breathe out? We already know how this system works with the cardiovascular. The respiratory system is what's going to exchange gases. It's going to bring in oxygen and allow us to breathe out CO2. And then, of course, once we do that, what is the heart going to do with that? Pump that oxygen-rich blood out. So the respiratory and the cardiovascular work together. Makes perfect sense. Also, the respiratory works with the urinary, and that has to do with regulating blood pH. Regulating pH. We've already talked about that very narrow pH range of blood, 7.35 to 7.45. What you may not know is that there are two body systems that regulate. We only really have two that are actively regulating pH. Respiratory and urinary. The respiratory does it by breathing out CO2. CO2 is acidic, so therefore we can breathe out more or less CO2 when needed to alter the acidity of the blood. All right, we're going to talk about that more later. What I wanted to just say here is the respiratory system is made up of the respiratory tract, upper and lower, some muscles that help us with breathing. Functions, of course, are to breathe in and out gases and regulate pH. Functions are exchange gases, regulate pH. So, here we're getting a little bit more into it. What is the main function of the respiratory system? Gas exchange. When we talk about gas exchange, we've got to be a little bit more specific. It helps us bring in oxygen. Why do we need oxygen? Because the cells need it when they make energy. And then, on the other side of it, we've got to not only bring in oxygen, but breathe out CO2. I don't think I like this red color. It's kind of hurting my eyes, so I'm going to change it. My apologies. When we say gas exchange, that alone is not enough. We've got to be more specific. We bring in oxygen because that helps our cells make energy. We breathe out CO2. When we have gas exchange, it happens through 4 processes, and these are happening in order. We've got to ventilate or breathe. Ventilation is the fancy word for breathing. So we have to do the mechanical process of breathing. Let's just say we were talking about oxygen. We've got to breathe to bring in oxygen. And then we do our first gas exchange, which is exchanging oxygen between the lungs and the blood. Then we transport that oxygen-rich blood throughout the body, where we have our second gas exchange, where we can exchange gases from the blood to the tissues. We're going to talk more about this later. For now, just introduce yourself to it. When we're talking about gas exchange, it doesn't just involve our lungs and breathing. We have to breathe to bring in the oxygen and breathe out the CO2. If we were following oxygen, again, I'm going to say it again, we'd breathe in the oxygen. Then we would have our first gas exchange. So if we're following along on this picture, What I have in red is the first step where we breathe. Then we have our first gas exchange, which is in yellow. Our first gas exchange is gas exchange between the blood and the lungs. That's happening here. So now we have oxygen in the blood. Then we do exchanging the gases, transporting the gases through the blood, step 3. And then once we get to the tissues, we have our second gas exchange at the tissues. This is the order of how we will talk about the function. We're not there yet, but this is setting the scene. Other functions that are important for the respiratory system, the biggest thing is pH regulation. Of course, we have some tonsils that can help us with immunity. You can see protecting the body from pathogens. We have the larynx, which allows us to make voice. And we have the nose, which allows us to smell. So those are the other associated functions, but the two that I want to focus on is gas exchange and then pH regulation. All right. Here's what I want to really set the scene with in this first video, and that is just the basic anatomy. We're going to cover the anatomical organization as upper and lower respiratory tract. Usually, the upper respiratory tract is nose, pharynx, and larynx. Upper. The lower respiratory tract is the trachea down to the lungs. Usually that's the designation. Anatomically, the upper, nose, pharynx, larynx, lower, trachea down to the lungs. Make sure you know that. We're also going to talk about a physiological organization. I'm going to come back to that. For now, let's just introduce the anatomical organization. Upper, nose, larynx, lower respiratory tract, trachea down. By the way, of course, the reason we have so many branches, trachea, bronchi, bronchioles, alveoli, is for surface area. The more surface area and branches we have, the more gas we can exchange. All right. I'm only going to point out what you need to know. When we talk about the lining of the respiratory tract, remember how we said in our first line of defense, the inner lining of the respiratory and digestive tracts are specialized? Because that inner lining of the respiratory tract is indirectly open to the outside. When you breathe in, that air comes in from the outside, through the nose, through the pharynx, through the larynx, into the trachea, down to the lungs. That lining is what we're talking about. I want to point out two specific tissue types. Sorry about that, just dropped my pen. I'd like you to be reminded that in the nasal cavity and the trachea, the inner lining of that tract for the nasal cavity and the trachea is pseudostratified ciliated columnar. You may remember from A&P1, this is when we have column-shaped cells side by side, but they're ciliated. They have little hairs. In the case of the nasal cavity and trachea, we rely on those little hairs. I think I got a picture. I got a picture later on of those hairs. You'll see. Of course, those hairs are going to allow the upper respiratory tract to filter out foreign particles. And the second tissue type of the respiratory lining that I want to point out is simple squamous epithelium. These are both epithelial tissues. One place where we have simple squamous is in the alveoli of lungs. There's my cat again. She's very vocal. Why do we have simple squamous here? Because we want a very thin layer, one layer of flat cells, thin layer to allow for gas exchange. So please review those. Okay, what I want to do is I want to go through pretty quickly the structure of the respiratory tract. Hi, Kima, we hear you. You're really going to make an impact here with my class. So let's just do it very quickly and we'll add the function. The nose, nasal cavity. Its function is warm, cleanse, and humidify the air. We're going to see this as a trend in the entire upper and even to the trachea, beginning of the lower respiratory tract. We want to warm the hair, cleanse or filter it, and humidify. Humidify means to add moisture. So the nose, nasal cavity, pharynx, larynx, trachea, they're all going to warm, filter, and humidify that incoming air so that by the time the air gets down to our lungs, it has been cleaned. It's clean, it's warm, which is going to help with filtering and, it's going to help with gas exchange. And we want it to be humid. What we're going to see in the lungs is when we exchange gases, let's say when we move oxygen through the alveolar membrane of the lungs into the bloodstream, we have to dissolve it in water first. So it helps when it's humidified. For now, just know that as the air comes in, it's warmed, filtered, humidified. You don't need to know the other structures for me. It's the nose, people. That's all we have to know. I rather like this picture. You know me with my weird views. But look, air is going to come in through the nose, pass through the nasal cavity, come back towards the pharynx, and then continue into the trachea. Okay? And here's the same thing over with the real cadaver. Air is going to come in through the nose. It's not really easy to see. Past the nasal cavity, down here, and into the trachea. I like this view, though, because it really shows you everything is so close. Like, for God's sake, here is the vertebral column, right? Isn't that wild? Look at the brain stem. Here's the brain stem. Everything is pretty close together there. Okay, when it comes to the nasal cavity, so the nose is just the nose, but pretty quickly we get to the nasal cavity. The nasal cavity is the second arrow that I pointed. This is the passageway after the entrance to the nose. It has those folds. It has these folds called nasal conchae. Lining this are folds in the bone. I don't think for your section you had to know those in A&P 1. So let's just make sure we quickly show you. Check it out. These are folds. Instead of the inner lining of your nose being flat like a wall of flat rock, Kima, for God's sake, instead of it being flat, it has folds where it goes out and in, and that increases surface area. And of course, lining these folds are cilia. So in the nasal cavity are folds in the bone, nasal cavity, or nasal conchae. For me, you don't need to know the superior, middle, or inferior. Just know the nasal cavity is lined with these folds called nasal conchae. Increases surface area. There's also going to be mucus in there. Together, this is more surface area for more filtration. We're going to see this in the lab. Then we get to the pharynx. So we're going to start making our way down, folks. We'll do black. So number 1 was the nose. Then we get to the nasal cavity that has those nasal conchae or folds. Then we get to the pharynx. The pharynx is otherwise known as the throat, but you're not going to say throat, you're going to say pharynx. The pharynx has 3 regions. Make sure you know those. The nasopharynx is the upper region, shown in yellow. The oropharynx is right by the mouth. This is a shared region between the mouth and the nose. And then the most inferior is the laryngopharynx. Gets us down towards the trachea. The function of the pharynx is the same as the nose and nasal cavity. Warm, filter, and humidify the air. Then we're going to get to the larynx. The larynx is the voice box. So if we're going to continue, we had the nose, entrance to the nose, nasal cavity. We had 3 regions of the pharynx or throat. And now we're going to get into the larynx, where our voice box is. Larynx is where we have the voice box. Larynx is where we have the voice box. What we're going to see here is a very important flap called the epiglottis. The epiglottis is this cartilaginous flap. When we swallow, this flap comes down. When we swallow, this flap comes down. So that way, when I swallow, I bring in food. When I swallow, it's going to go down the right tube. We want food to go down the esophagus. So only when I swallow does that epiglottis swing down to cover the entrance to the trachea. Usually, the flap is up. The epiglottis flap is up. It only comes down when you swallow. So that way, food has nowhere to go but in the correct tube, the esophagus. Otherwise, when I'm not swallowing, we want that cartilage to be up. So when I'm not swallowing, when I breathe in air, I want the air to be able to go in the trachea. Okay. Basics of the larynx. Within the larynx or the voice box. Here, it's just shown as a slit. You see how it's shown as that slit, as the larynx with the vocal cord? Here's what it looks like if we put a camera down the throat. If we put a camera down the tube of the throat, here's what it looks like. Make sure you know the basic structure. The glottis is the opening. So in this view, the glottis is the opening. We want air to come through there, okay? So that's why there has to be an opening. Lining the opening are these particular folds called vocal cords. Lining the opening are these little cords called vocal cords. So what happens is when we force air down there, when we want to, we can vibrate those vocal cords. And the vibration of those vocal cords allows us to produce sound. Keeping the vocal cords in place are these areas, it's almost like a little curtain thing, called the vestibular folds. These are the little areas that connect the vocal cords to the body. So the black is only the vocal cords, just those particular little flaps. But the flaps are connected to the rest of the respiratory tract by the vestibular folds. Right, so here we can see it again. This is my best view. The opening is the glottis. The specific flaps right against the opening are the vocal cords that vibrate. Connecting the vocal cords into place are this little fan-shaped tissue named the vestibular folds. All right, good stuff. So here we can push air in through the glottis, and then we can kind of open or close that glottis. And in doing so, we can create sound. I'm going to let you see this in lab. The larynx, here's a lateral view. The larynx is very, let's see, vocal cord, here we go. Those vocal cords are really delicate, and they're very anterior, so we want to make sure that we protect them. So, on the anterior in front of the larynx, we have 2 pieces of cartilage. The big one is the thyroid cartilage. This whole thing is the thyroid cartilage, commonly thought of as the Adam's apple. The piece of cartilage right below it is the cricoid cartilage. And then we get into the cartilage pieces of the trachea. For me, for this particular class, you don't need to know the inner cartilage pieces. There are some inner flaps of cartilage. We're just going to know the main two outside ones. You're going to have a chance in lab to review all of this. So, if we're going to review, we had the nose, which then came into the nasal cavity, which had some folds in the side of the nasal cavity walls called the nasal conchae. Then we got to the pharynx, 3 regions, nasopharynx, oropharynx, and laryngopharynx. And then we got to the larynx, which houses the vocal cords. Now we're into the lower respiratory tract. And the lower respiratory tract, actually, probably more accurate to make that line below the larynx. Now we get to the lower respiratory tract, the trachea. What are some important things to know about the trachea? The trachea is covered by C-shaped cartilage rings. They don't go all the way around. We can see the front of the cartilage rings here. That's what keeps the airway open. We want this trachea to be open all the time because we want to be breathing all the time, so we're alive. That's different from the esophagus, which is behind the trachea. The esophagus is flat when empty. Here's a cross section. So this is what the C-shaped cartilage ring would look like. But look at the back. The back lining. The cartilage doesn't go all the way around the tube. Instead, the cartilage is more C-shaped. And lining the back is muscle. And that muscle is called the trachealis muscle. So, all along the trachea is covered by these C-shaped cartilage rings, and lining the back is a muscle called the trachealis muscle. If you're wondering, the reason why is because, I'm going to go back for a moment. I'm sorry to give you a headache. I'm not trying to give you a headache. If we want to know the reason why, check it out. So here's the trachea. The trachea has cartilage covering the front of it. However, the back is smooth muscle. It is that way solely because of the esophagus. I'm not going to ask you on a test for this yet, but if you're wondering. Remember I said the esophagus doesn't stay open. The esophagus only expands when we swallow. So when I eat some food, it's going to go through the mouth, through the oropharynx. The epiglottis is going to come down to cover the opening of the trachea, which means the food is going to go down the esophagus. The fact that the back of the trachea is smooth muscle means it has a little give to it, because what's going to happen is, let's face it, folks, don't we all swallow big chunks of food? We chew it a little bit, but we swallow big chunks of food. So if I swallow something that's a little bit bigger, the esophagus can expand. And the smooth muscle in the back of the trachea can kind of come in a little bit, just for those moments when you swallow. The important thing that we want to know is the trachea has C-shaped cartilage rings covering it, and lining the back is the trachealis muscle. We already reviewed that the inside of the trachea has that ciliated pseudostratified epithelium with little hairs that trap particles, because the function of the trachea is just like the function of the nasal cavity and all parts of the pharynx. Cleanse, warm, humidify incoming air. Here's an actual look at the inside of your trachea. I know it looks like shag carpeting from the 70s, but, up close, lining, that inner lining is a pseudostratified columnar with little cilia. So as air goes through it, Those little cilia trap foreign particles. See those little red things? Those are foreign particles. So we trap them in the cilia, and then there's some mucus. The mucus is the orange. So what happens is then we trap those foreign particles, and then all the cilia move in one direction at the same time to push that foreign debris back up from your trachea, through the pharynx, through your nose, and then you blow it out. Okay, what I really want to continue to focus on is just the order, right? So after the trachea, if we were doing our numbering system, there's going to be a break. These are called the bronchi. The bronchi also have C-shaped cartilage rings covering them. The spot where they separate, there's a little elevated ridge called the carina or carina. Elevated cartilage ring. I know I'm going quickly, but you can always pause, go back, practice the anatomy, practice, practice, practice. Right at where the trachea splits into the bronchi, there's an elevated piece of cartilage called the carina. The opening in the spongy-like lung where the bronchi enter the lungs is called the hilum. The hilum is an opening. The lung is literally like sponge. So we need a little opening or a hole where we shove the bronchi through. The bronchi have different parts to them. The primary bronchi, that would be the primary right and the primary left bronchi, then branch off into secondary bronchi. The secondary bronchi branch off into tertiary bronchi. You don't need to know the numbers, but we're talking about branching for surface area. So the idea of all this branching is to increase surface area for more filtration. The primary are just the first two, and then the primary break off into secondary. What I want to say also, the primary, don't forget, have those cartilage rings around them. By the time we get from the primary to the secondary, in this picture the secondary are red, to the tertiary, blue. By the time we get to the tertiary, we have now transitioned to smooth muscle. The primary bronchi, the covering of the tube is cartilage rings. Here in the secondary, it starts to transition from cartilage rings to smooth muscle. By the time we get to the tertiary bronchi, all smooth muscle. I think it's helpful. We're not going to go that much longer, folks, so stay with me. I think it's helpful to draw. You know me, folks, I cannot draw for crap, but let's do our nose. Our little dude, okay? So we can practice. So we had I'm going to do a different color for each one. We had the nose. The nose then went into the nasal cavity. The nasal cavity has those folds in the bone called nasal conchae. Let's change color. Then we got to the pharynx. And the pharynx has three regions: nasopharynx, oropharynx, and laryngopharynx. The function of all of these is to warm, filter, and humidify incoming air. I'll make this a little bit longer. This is not drawn to scale, but by now you know that about me. Then we get to the larynx. The larynx has the voice box. From the larynx, we go into the trachea. the trachea. The inside is lined with pseudostratified ciliated columnar, little cilia to help with filtration. The outer part of the trachea has those C-shaped cartilage rings, but the back is made up of muscle. Then we get to the primary bronchi. Primary bronchi. The primary bronchi have cartilage rings covering them. Then we get to secondary bronchi. The secondary bronchi, we're now transitioning from cartilage rings to a little bit of smooth muscle. Then we get to the tertiary bronchi. By the time we get to the tertiary bronchi, we have gotten to all smooth muscle. Terrible drawing, but please just get the order down. Now, after the bronchi, I would like to point out these are all bronchi. Bronchi, bronchi. That's all we can see from this view on this picture here. Now we're going to have to get microscopic. When we get microscopic, now we're talking about bronchioles. Not just bronchi, bronchioles. And the order is just a regular bronchiole. Then we have the branches off that, which are terminal bronchiole. And then we have respiratory bronchiole. The key about these bronchioles, they're all smooth muscle, which allows them to be able to constrict and dilate, to alter airflow. Does this sound familiar? This is where I get excited. This is where I wish my cat was meowing. This is the time. Do you remember how arterioles are able to constrict and dilate to regulate blood flow? Well, now we can see the bronchioles. Not so much the bronchi, the bronchioles. They can constrict and dilate to regulate air flow. So let's go back to our drawing here. Now we get microscopic. Coming off of the tertiary bronchi is another branch called the bronchiole. Now we're no longer in bronchi, bronchiole. Spelling matters, folks. Spelling matters. Coming off of the bronchioles are terminal bronchioles. This is also a confusing point to some people. Technically, there is a part of the airway that's just bronchiole, and then we get to the terminal bronchioles. Coming off the terminal bronchioles are the respiratory bronchioles. This can be a little confusing because when we think of terminal bronchioles, doesn't terminal mean end? So you might think that the terminal is the end. It's not the end of the airway, and we're going to discuss that in a moment. Folks, we're almost done. Stay with me. So again, what's the order? Bronchiole. The bronchiole branches into terminal bronchioles. Each terminal bronchiole branches off into respiratory bronchioles. And importantly, folks, it is the respiratory bronchioles that lead into the alveoli. Leads into the alveoli. So let's finish our drawing. It is the respiratory bronchiole that leads into the air sacs that we know as the alveoli. Okay. Here's where I want to go back to our discussion of the anatomical organization and the physiological organization. Quick reminder about the alveoli. This is where we exchange gases, of course, and this is lined with simple squamous epithelium. Look at how many we have. What? We can exchange a lot of gas. I'm going to go back, avert your eyes if this is going to make you a little sick. Remember at the very beginning, we said that there's an anatomical designation, upper and lower respiratory tract. Let's go back to my terrible drawing. I'm going to use blue to show us upper versus lower. We remember the upper respiratory tract is nose, pharynx, down to, oh, I went too far, down to the larynx. Upper. This is the upper respiratory tract. And then the lower respiratory tract is the trachea down. So the upper is the nose, nasal cavity, pharynx, and larynx. Lower is the trachea down. We already established that. But let's talk about the physiological organization. We have two zones. I'm going to use green for this. We have what's called a conducting zone and then a respiratory zone. This has to do with function. It's hard to read that green. This has to do with function. The other one was just an anatomical layout. Upper and lower. One is higher, more superior, upper. One is lower, more inferior, lower. That's just a structural designation. Here, we're talking about function. Why this first one is called the conducting zone is because what is its function? To conduct gases, to move gases in and out. This is from the nose all the way down to the terminal bronchioles. That's why it's called terminal bronchioles, because it's the end of the conducting zone. However, once we get down to the respiratory bronchioles and the alveoli, respiratory bronchioles down to the alveolar sacs or alveoli, this is considered the respiratory zone, because guess what can happen here? Gas exchange. Wow. So let's now put that on our drawing. It's a really bad drawing. I'm going to use green. So let's do the functional. Here was the anatomical designation. Upper respiratory tract versus lower respiratory tract. Upper versus lower. But now let's get physiological. That should be a song. No, I'm joking. The physiological separation, which has to do with function. The conducting zone. Do you remember the conducting zone? Functionally, most of the respiratory tract conducts gases. It just moves gases from the nose all the way down to and including the terminal bronchioles. That's why it's called terminal. It's not the end of the airway, but it's the end of the conducting zone. So nose all the way down to the terminal bronchiole is what's considered the conducting zone, because the function of all of these areas: conduct gas, bring it in, clean, warm, humidify. Filter, warm, humidify. Say it again and again and again. All the way down from the nose to the terminal bronchiole. And then the respiratory bronchiole, use a different color. I use black. The respiratory bronchiole, numbers 11 and 12. The respiratory bronchiole and the alveoli are considered the respiratory zone. Because what can happen here? gas exchange. Does that clarify why this is called the terminal bronchiole? It's not the end of the airway completely, but it's the end of the conducting zone. The respiratory bronchioles and the alveoli can both do gas exchange. All right, we're going to end there. We have a nice introduction to the anatomy. It's going to make our discussion of the physiology much easier. All right, folks, good job. Study hard. Let me know if you have any questions.